PodcastRx.
PodcastRx.
Welcome to PodcastRx from Diamond Pharmacy, a show featuring the pharmacists and personnel behind the nation's largest correctional pharmacy provider. While we talk primarily about clinical and regulatory topics affecting the institutional healthcare clients we serve, we'll also occasionally get into the stories behind the people moving our company forward. This isn't just a pharmacy podcast, and you don't have to be a clinician or a pharmacist to enjoy it. On this episode, Diamond nurse practitioner and infection control coordinator Debi Yackuboskey returns to discuss the outlook for respiratory disease season. We talk about all three tripledemic respiratory diseases, influenza, COVID, and RSV, and what's new and or noteworthy about each in terms of basic virology, prevention, and treatment. With the debut of the RSV vaccines and newly updated COVID vaccines in the mix, there was a lot for us to cover. I'm Adam Campbell, and welcome to PodcastRx. Well, hello, Debi. Welcome back to PodcastRx. How's life in your corner of Diamond treating you?
So far, so good. We just got over administering flu vaccines to our employees this year, and of course, putting a lot of information out about flu vaccines. And I've been fielding questions regarding the COVID vaccine, as well as the RSV vaccine from some of our employees already.
Well, I'm so glad that, of course, you're out leading those efforts. And of course, that's why I wanted to have you on the show today, because about a year ago, we recorded an episode discussing mostly flu vaccines and your outlook on the upcoming respiratory disease season. So, of course, it's fitting that, we have you back and we could talk in a similar way about the 2023-24 respiratory disease season. It's underway, of course, and look not just at flu, but also COVID, RSV, and an interesting development between this year and last is now we have vaccines in the mix against RSV.
That is correct, Adam. Yes, we do.
And, usually when we're talking about a historic cold and flu season, that's kind of implying something negative, like unprecedented hospitalization rates or something like that. But this time around, the history being made, at least to start with, is rather positive with the debut of these vaccines for RSV. According to the CDC's respiratory disease season outlook, the agency expects to see a similar number of total hospitalizations compared to last year. Of course, number is such a moving target, dependent on so many factors. I wanted to ask Debi, from where you sit as a nurse practitioner and an infection control specialist, how do you feel about the CDC's overall assessment for the respiratory disease season, and what's your own outlook for the season?
I think that the CDC is spot on right now. I did have an opportunity to take a look at some of the latest data from the CDC. And right now, what is available online is that they were looking at information for week 43. And week 43 actually ended October 28th. Seasonal activity right now remains low. We are slowly inching up, which we normally see this time of year, but it still is remaining low nationally, as well as the hospitalization rates are remaining low. But keep in mind, Adam, that peak flu season isn't until February. So we usually start out low, and then we continue to kind of progressively go up till the point where we are higher and getting a little bit closer to peak. Now, last year, the CDC identified the flu virus H1N1 as the most predominant flu virus out there, and it continues right now to be the most predominant flu virus out there at this point in time. Hospitalizations, like I said, remain low, and the CDC is out there, putting it out there that anybody who is of 6 months or greater and has no contraindication to receiving the flu vaccine really should take the initiative and go get that vaccine.
Yeah, most definitely. And I'm glad you started talking about influenza right away, because I wanted to go through each of the major respiratory diseases and talk about them a little bit related to the overall outlook, noteworthy characteristics of each. So starting with influenza, you mentioned H1N1 in particular. And of course, the importance of vaccination. Everyone 6 months and older, that's the best way to prevent severe illness. That continues to be the case. Are there any other noteworthy characteristics of influenza worth noting?
Yeah, not at this point in time, Adam. We seem to be starting out very similarly to what we did last year. And, the flu vaccines that are out there and available right now target not only two type A viruses, which are usually your more severe forms and they cause more severe illness, but they also contain two type B viruses, which are less severe. This year, because of the fact that it was identified that the most predominant viral strain out there last year was H1N1, that definitely is contained in this year's flu vaccine. So that being said, H1N1 right now is the most predominant strain. We continue to think that that's going to be the case moving forward, and that the flu vaccine that is currently out there will take care of that. Now, if there are any flu vaccine strains that are out there and circulating that are not in the vaccine at this point in time, at least getting the flu vaccine will help to not only lessen the severity of illness for individuals, but it should also shorten the course of illness for them as well. So even if we are dealing with a strain that is not contained in the vaccine, it will help.
One prominent change related to flu vaccines is that special measures related to egg allergies are no longer in effect. Why is this?
Well, what they found out, it just started with this particular year, 2023-2024, that the additional safety measures that we had in place for individuals who had egg allergies really don't need to be in place. They've done some research, and most of the vaccines that are out there obviously are egg-based. Previously, we had done a podcast, I believe last year, when we talked a little bit about the different types of vaccines available and the fact that a lot of them are egg-based and a lot of them do contain some portions of egg proteins. So what they did is they did some research and they administered both the nasal form of vaccine as well as the injectable form of vaccine into not only individuals who were not allergic to eggs, but also to individuals who are allergic to eggs. And they really found that those who are allergic to eggs really didn't have any kind of severe allergic reactions. So that's why they went ahead and changed course this year and decided that it was okay for those with egg allergies to go ahead and receive the flu vaccine.
Are there any other important take-home facts about influenza this year that the audience should be aware of?
I would recommend that you just be aware of what type of flu activity is going on in your area. Make sure that you're doing all of the protection that you should to prevent yourself from getting the flu. If you do know of individuals that are either in your own household, workplace, if your kids are around individuals who are at school, just to take the necessary precautions. And as always, the biggest thing that as far as the prevention of infection is hand washing. Just hand wash and take the necessary precautions. If you're going to, sneeze, if you're going to cough, if you're going to blow your nose, make sure you're using a Kleenex, you're discarding it properly, you're doing your proper hand washing, which is at least 20 seconds when you're doing hand washing, and using good, firm action on your hands, lots of friction, and making sure that you're shutting off the faucet after you've dried your hands with the towel that you dried your hands on. If you're sick, obviously, stay home. Take care of yourself. Take the over-the-counters, and just protect yourself from getting infection or giving infection to somebody else.
It's great that a disease like influenza that causes so much stress each year is kept in check with relatively common sense measures when it all comes down to it.
And that's what we saw, Adam, when we were at the height of COVID, is the fact that there were so many measures put into place, the hand washing, the masking, the social distancing, that particular year, 2020 into 2021, we saw very, very, very low flu activity because we were doing all those easy steps that we could do, but they were so important in the prevention of the transmission and the prevention and transmission of COVID to others. Sure.
That was a nice transition right there. Let's move on to COVID. As far as COVID-19, Debbie, as you did with influenza, talking about H1N1, what of COVID-19? What are the particular variants, the strains of COVID out there this season that we need to be aware of?
Okay, they just identified one here not too long ago, Adam, actually back in September. And according to the CDC, right now, the most predominant is what we call HV.1. And it was first identified midsummer, but it wasn't until September that cases began to spike. And right now, it's causing about 20% of all the COVID cases in the country. And it is the most predominant strain at this point in time. HV.1 is classified as what we call an Omicron XBB variant. And if you recall, we had a variant called Eris before, which was an EG.5 variant. And actually, HV.1 is just a descendant of the Eris variant. So Eris or EG.5 continues to be a predominant variant, as well as the HV.1, which is the newest one out there. So it is kind of like a descendant of the Eris. Both of them actually are Omicrons. So they come from the original COVID viruses, and they are both what we call XBB descendants. Now, looking at the COVID vaccine that's out there, the updated vaccines that were just approved here back in September or in early fall, the Pfizer and the Moderna vaccines actually target a different XBB variant. It's called XBB 1.5. But they have found that even though that variant is what's in the COVID vaccine, they feel that both vaccines will offer the cross protection against what is currently out there as far as variants. So they are recommending that everybody who can and who do not have a contraindication should get the COVID-19 vaccine.
Yeah. I understand you just got yours today.
I did, Adam. Yes, as I was telling you prior to the broadcast, I actually had an appointment set up today, and I actually went and got my COVID vaccine. Yeah.
Yeah. Can you tell me a little more, Debbie, about who exactly should be getting the COVID vaccines as far as recommendations?
I think you have to look at comorbidities, age, obviously, if you have underlying issues going on. They're recommending that individuals, obviously, who have respiratory conditions, individuals who have COPD or who have asthma, should be going and getting the COVID-19. They're recommending individuals who are immunocompromised and who are very wide open to any type of infection and illness should go get. Obviously, you're looking at the age spectrums as well. Older people, senior citizens should be going and getting those. So, anybody who is at risk for developing a severe infection and cannot risk getting like a respiratory infection, such as what COVID can evolve into.
What's interesting about these updated vaccines is that's what they're being called, updated vaccines. They're not boosters.
No.
What's the difference between the boosters of yesteryear and now these updated vaccines?
Okay, if you recall with the boosters, we would get one, and then it seemed like over time, the protection that we received from the initial vaccine kind of waned. So what they would do is obviously the FDA and the CDC, they would look at all of the data and the research from the companies that manufacture the vaccine. And based upon that, they would approve, and they then would give you what they did call at that time a booster, which helped to kind of increase your immunity to COVID, because, like I said, over time, that immunity waned because the vaccine that you had in you just was not as effective any longer. So each subsequent time, you would get a booster, which would help to bring, your protection up to a higher level to what it might have been when you initially got that shot. Now, this year, what they did is with the research and over time, we're already into 2023, and we had our first cases enter into the United States in 2020 of COVID. what they have determined is that we're probably going to have an annual vaccine, something similar to what we're doing with seasonal influenza vaccines. Right. So that's why it's no longer called a booster, because it's just something that's going to be more commonplace, like that seasonal influenza, where you're just going to have to get it year after year after year.
Understood. Of course, so much of the discourse around COVID revolves around vaccines, but there are other COVID treatments. Could you walk through those really quickly?
Surely, I can walk through those. We have a few that are available at this point in time. Now, obviously, if somebody does have a COVID-19 infection, most of the time it's going to be flu-like symptoms. You're going to probably just stay at home and treat the symptoms with over-the-counters. But if you're in one of those at-risk groups, or you're somebody who's very prone and susceptible to upper respiratory type infections, there are treatments that are available out there that you would want to discuss with your PCP, and these really need to be started. If you are considering a treatment, they really need to be started within 5 to 7 days after the symptoms start. So it's not something you want to wait a couple weeks on. If you truly think you have COVID and you've tested for COVID, you definitely want to get to your PCP and get the prescription for one of these products. But there's actually a few out there. I think the biggest one that you probably are most familiar with is Paxlovid. Paxlovid is what it's called, and it actually is indicated for anybody who's age 12 and older. And it's just a tablet that you take, okay, and you take it as prescribed. Another treatment out there is Veklury. And that actually is indicated for use in both children and adults. So that's nice that the kids have a treatment that's effective for them. The difficulty with this is that it's an IV infusion. Mm-hmm. And with the IV infusion, it's something that has to be done in a healthcare setting, and the individual has to have the IV infusions over 3 consecutive days. So that makes it a little bit harder than taking a pill such as Paxlovid.
Sure.
The other one is Lagavrio. And it's indicated for the use in adults ages 18 or older. So again, this is not something that is targeted for kids. It's for 18 and older. And it is taken by a pill as well. So we have 2 that we can take orally, 1 that can be taken through IV infusions, and that particular one is indicated for children as well.
Moving on to the third disease, RSV, respiratory syncytial virus. As I alluded to the top of the episode, this is a historic respiratory disease season, as it's the first time we're seeing vaccines used to combat RSV. And there's actually 2 vaccines, both approved by the FDA back in June. Let's get into the mechanics of these vaccines for a second. Debbie, how do they work, and who are they ultimately recommended for?
Okay, with the RSV vaccine, this actually introduces an inactivated RSV protein into the body. Okay, so this is a dead virus, just like the seasonal influenza. There's no live virus that is being injected into your body. This is a dead virus. And what this actually does is then it fuses to host cells within the body, and it stimulates the immune system to build itself up. And then should an actual RSV viral cell enter the body, then what happens is when it encounters it goes into activation mode, and it helps to prevent severe infection, because the body already has built up its immune system when you got the RSV vaccine. So when you actually do contract, or if you actually have RSV enter the body, it's not going to be as big of a deal because your immunity level is high at that point in time. So right now, there are 2 vaccines that are approved to do that. They are indicated for individuals who are 60 years or older in age. And there are, like I said, there are 2. One is called Abrexivir, and that's actually by the manufacturer GlaxoSmithKline. And the other one is called Abrevzo, and that's actually by Pfizer. I've seen many commercials on television regarding both. I went to the pharmacy today and got my COVID vaccine, and they had a great big placard right there that talked a little bit about Abrexivir. So it is out there. It is available for 60 and older at this point in time. And the nice thing about the Abrevzo is that back in August, it actually was approved by the FDA to be used in pregnant moms-to-be, so that it prevents an infant from having lower, if mom gets an RSV infection, it gives protection to her unborn baby.
With these vaccines, there's a phrase, shared clinical decision-making. It's a key phrase when one is deciding to get these vaccines. Why is there not a more blanket encouragement for RSV among the designated patient populations?
Well, with shared decision-making, unlike routine catch-up or risk-related based recommendations, shared clinical decision-making vaccines are not recommended for everyone in a particular age group or a particular risk group. And what it means when you're talking about shared clinical is that, the individual patient needs to sit down with their PCP, with their provider, and take a look at their individual risks. And based upon that conversation that they have with their own doctor, they may or may not need to have the RSV vaccine. Obviously, if there's somebody who is prone to severe upper respiratory infection, if they have a low immunity, they probably will want to go ahead and make the decision to get. But if you're healthy, I'm 65 years old. If you're healthy, if you don't have respiratory infection, it may not be what I need to do at this point in time, for example, versus somebody who has a lot of conditions going on or an immunity level that just is not that good. And generally, what happens is the ACIP, or the Advisory Committee on Immunization Practices, makes what they call shared clinical decision-making recommendations when individuals may benefit from a vaccination, but the broad vaccination in a group is unlikely to make any difference in the overall population or have any type of impact for the overall population. So, for example, if they're saying over 60, if we give it out to everybody, it may not make a difference versus just giving to those who are more at risk.
In addition to these first-time vaccines, there's also a monoclonal antibody RSV treatment for small children. What can you tell me about this?
Mm-hmm. It's great. We finally have something that can work on children, and it's called Beyfortus. And actually what it is a human recombinant monoclonal antibody with activity, as you said, Adam, against RSV. It is indicated for children and infants who are less than 24 months of age, and it helps to prevent lower respiratory tract disease if that infant is diagnosed with RSV. It's the first to be approved, and it is widely recommended and used in the United States. And, up until now, we haven't had that. And typically before now, RSV was a childhood disease, right. And it affected children, and it affected infants. And oftentimes it ended up where the infant had to be hospitalized. So we've got this nice treatment that we can give them now, this monoclonal antibody that will help to decrease the symptoms if they do get it.
Sure. And I actually have a child due in March of 24. So that's something definitely I'm glad to know about.
You'll want to consider, yes.
For sure. As someone with long-term care oversight in your everyday work, and of course working a lot with the senior population and people in senior living facilities, how excited are you to have this vaccine, this new RSV vaccine in the armory?
I'm very excited to have it because, obviously over time, as the science is out there, as the research is out there, and we have more that's available to us as practitioners, as that is, a win-win situation, not only for myself as a nurse practitioner and being able to have something that I can give to a patient, but also as a scientific-based person, I actually have a strong background in science. I was a science teacher. And
I didn't know that.
Yeah, I was a science teacher at one point in time. So science, the scientific world and having that scientific research behind you there is definitely great to have the arsenal that we have. And over time, as we have more things that we can use to keep people healthy or to return them back to health, it's a win-win situation. I'm very excited to have it and to have the things that are available. And, sometimes it takes bad things to happen in order to have good things come out of it.
Right. A couple of broad questions I wanted to ask to wrap up our discussion today. One common question asked in these tripledemic times, is it safe to get multiple vaccinations at once? Can you get your flu, COVID, and RSV shots out of the way all at one time, or is it best to spread them out?
You can. A quick little story here, Adam. When I was getting mine today, there was an elderly couple in front of me, and we got to talking as we were waiting. And the couple said that they had not gotten their flu shot yet, but they didn't want to get their flu shot. They were getting their COVID today. Mm-hmm. They did not want to get their flu shot and the COVID shot together because they just didn't know how they'd react, even though they had heard that you can. The scientific research out there has shown that you can get the flu vaccine and the COVID vaccine together. A lot of people don't want to do that because of the fact that how are they going to know if they do have symptoms after they get a shot? How do they know which one's causing the symptoms? Mm-hmm. So a lot of people are waiting and doing one and then maybe waiting a week or two and going back and getting the second. There are people, obviously, who are going and getting them both because they know they can. So the scientific research says there's no reason why you can't. There's scientific research out there that is showing that you can also get the RSV and, the flu together. There's been some clinical trials and research on that. Right now, there's not really been a lot of clinical trial work or research on getting the three together, getting the flu, the RSV, and the COVID together. But, you can get the COVID and the flu together.
Okay.
That's not a big deal. Or you could get the RSV and the flu together. That's not a big deal either.
Okay. One area that we spent some time in conversation last year during our podcast was about vaccine hesitancy. Because vaccines are so central to keeping these seasonal diseases from causing severe illness, it's an important topic to address once again. As you wrapped up your own vaccine clinics, did you see a higher incidence of hesitancy in the community this year? And how did it compare with last year? And do you ultimately think vaccine hesitancy is improving or getting worse?
I actually think it's getting worse, Adam.
Okay.
Here we are. We started all of this back at the end of 2020 into early 2021 when the COVID vaccines came out. We saw a lot of interest in the vaccines, obviously, because that we as a nation and we globally were just seeing a lot of illness and a lot of death. So we saw where people were interested in getting the vaccine. Then it just seemed over time as each subsequent booster came out, people started to kind of get a little weary of this.
Sure.
They just didn't buy into it like they did. And as we saw the COVID pandemic starting to kind of wane, we even saw more hesitancy about going and getting vaccines because the threat wasn't real and in front of us as much as it was when it initially came out. We've always had that vaccine hesitancy with flu. People, always have different reasons for why they're going to get a flu vaccine or why they're not going to get a flu vaccine. We saw that with COVID as well. We had the pro-COVID vaccines individuals. We had the anti-vaccine that kind of split us, as you well know. And I think those who are in older age groups kind of jump on the bandwagon to get every vaccine that's available out there versus individuals who are maybe 18, 19 or 20s or 30s because they don't feel that there's a need to get it. They're young, they're healthy, They don't think they're going to contract COVID, flu, RSV, whatever it might be. So we are seeing some hesitancy. And I think it's just because over time we've just gotten wary of all of this. This is 2023. We're into 3 years into this already. And people have moved on with their lives and they're out there doing everything they did prior to the pandemic.
Sure.
So it's not as real to them to go out and get the vaccines any longer.
Sure. And I think even when you were talking about COVID variants and, there was a lot of numbers and letters there, and it can get difficult to follow all that after a while.
Yeah. And I think, too, the information isn't out there like it was when we first started back in 2020 and 2021. I mean, we had so many public announcements about this and so much information that we were bombarded with, and you're not seeing that now.
Right.
So the push really isn't out there. And like I said, the RSV is a shared clinical decision making. So, that's not as big as far as the publicity is and the information that's getting out there. As in COVID, we're not hearing that much about it anymore. Sure. So I think people have just kind of gotten weary of it. And that's why we have the vaccine hesitancy.
Right. Well, and in part two with COVID now, it's not novel anymore.
Right. And it's, like I said, it's not a real threat anymore because it's not a pandemic. We're not in a pandemic anymore. Right. So to a lot of folks, it isn't a real threat to them any longer. And also, for the majority of the part, if somebody does get COVID, it's not going to be fatal. I mean, a lot of symptoms are very mild now. When somebody gets COVID, the symptoms are mild flu-like symptoms. And most people are feeling that, okay, I have COVID, so I got a little flu-like symptom. I'm going to stay at home and I'm going to take my over-the-counters and I'll be fine. So it's not, a life and death threat any longer like it had been.
Well, Debbie, I want to thank you so much for taking the time to come back on to PodcastRx, give this lovely roundup of everything related to the respiratory disease season. Thank you for all your work in coordinating the vaccine clinics here at Diamond and everything you do out in the communities as well.
Well, thank you, Adam. We always try and prepare. We prepare for the worst, but we hope for the best, and that's all we can do.
Certainly. Well, I hope we'll get to talk again soon. Thank you again so much.
Thank you, Adam.
PodcastRx features conversations with healthcare professionals. The statements and opinions discussed herein are for informational purposes only. This podcast should not be considered professional medical advice and should not be used as a substitute for the advice of an appropriately qualified and licensed healthcare professional. Therefore, listeners must not rely on the statements made herein. But we do hope you enjoyed them.
PodcastRx is a production of Diamond Pharmacy Services, the nation's largest correctional pharmacy provider. Keep up with our show on all the major podcast platforms, including Apple Podcasts and Spotify. New episodes usually drop the first full week of each month. Where possible, please rate and review the show to help us reach more listeners. If you have any questions or feedback for PodcastRx, we'd love to hear it. Shoot us an email at podcastrx@diamondpharmacy.com. We thank you again for listening.